Well, hello, everybody. So let's talk the next speaker for today on our session about a tour of radiation, the radiation department. I'd like to introduce Cyndy Penner, and Cyndy is the Quality and Education Coordinator in the Radiation Oncology Department, or in the Radiation Oncology Program with the School of Radiation Therapy here at CancerCare Manitoba. And Cyndy will be presenting us on a guided video journey and introduction to radiation therapy. So you get a really good picture, a real live picture of what it would be like to have radiation therapy here at CancerCare Manitoba. So I'm going to hand it over to Cyndy, and then I will be back for the Q&A. So remember, as we go through the session, any questions that you have while Cyndy is speaking, please put them in the Q&A, and we will have a chat about them at the end of the session. So thanks very much. Over to you, Cyndy.
So we'll just jump into it. Good morning, everyone. And I just wanted to acknowledge the importance of equity in our discussion today. I wanted to let you know that we value diversity and inclusion, and we want to recognize that different individuals bring unique perspectives and experiences to our conversations. And so for our time together this morning, I encourage everyone to be mindful of these differences as we want to create a safe space for everyone to learn about radiation therapy. So I don't know what brings you to this session today. Are you here because you're exploring your treatment options, which might involve radiation, or perhaps you're currently undergoing radiation treatment or had it in the past? Maybe there's some cancer support persons among us today, eager to understand more about radiation and how it works. And lastly, we may just have people, sometimes like myself, that are just curious to learn more about radiation. So I just want to welcome you all here. And for whatever reason you're here, I'm very sorry that being part of a cancer experience has happened to you. And I hope that this information that I share with you about radiation treatment today is helpful. So should treatments be something that you need to consider, or perhaps you have already received treatment, we do hope that these videos that I showed today will be helpful for you as you go through this experience or explaining things that you may have gone through previously. So I hope you have a nice hot coffee, black according to Dr. Rettich, no cream in it, and we'll be good to start with the videos. So before we get into that, I just wanted to let you know a little bit about how we developed some videos. Earlier this year, we asked our radiation therapy patients who were currently having treatments that if there was an opportunity to develop a video for future patients, what information would they like to see in video format? And I've listed some of the responses here. And since that time, we have completed the development of 7 short videos that will be posted on the CancerCare website to view in the very near future. And we hope that they're going to be very helpful for everyone. So for today, what we want to do is go through 3 of them. And the first video is general information about radiation therapy. The second one introduces the radiation therapy care team that you would meet if you were having treatments. And the third one shows the steps needed to prepare radiation treatments and how they are administered. So unfortunately, there will be a very short time for questions after the videos. But if you have further questions, I would be happy to respond to anything emailed or that I receive later as well. So let's get started. So I'm hoping Owen can put on the videos for me, the first video.
Welcome to the review. We have designed this series of short videos to help you prepare for your radiation treatments. We invite you to watch the videos to familiarize yourself with the steps involved for radiation treatments and to introduce you to the team. We encourage you to pause the video or rewatch sections of it if you wish to do so. We also encourage you to invite someone to watch it together with you so that they hear the same information you do and can support you throughout the radiation treatment processes. This first video will introduce you to how radiation therapy treatments work and your radiation treatment team. Radiation is in the world all around us. Radiation therapy is the delivery of specific types of radiation in a controlled, monitored environment using safe methods based on the most current research, knowledge, and practice standards. Radiation therapy is used for treating many types of cancer because it is good at shrinking and destroying the targeted tumor area without causing too much harm to the normal surrounding tissues. It is used to treat a variety of cancers and some non-cancer conditions. Patients may receive radiation treatments only or in combination with surgery, chemotherapy, or other types of treatment. Your oncologist will review your case together with you and provide you with the best treatment options for you. Radiation treatments are designed and customized to be unique for each patient, with the main goal being to treat the area of concern with high doses of radiation while minimizing doses to healthy surrounding tissue. This customization results in the best possible treatment outcomes with the least possible side effects. During radiation treatment, the high-energy radiation waves pass through the body to reach the cancer cells. Radiation therapy interrupts cell DNA, so the cells stop growing or are destroyed. This results in a tumor shrinking. Most normal tissue cells don't die with radiation therapy because they do not divide as quickly, and if they are harmed, they are better able to repair themselves than cancer cells. Some patients ask if radiation treatments are painful or if they may become radioactive. Please know that radiation does not hurt, sting, or burn when it passes through the body, and that you will not become radioactive with the treatment. It is also safe for you to be near other people after your treatment sessions. There are two major types of radiation treatments: external radiation and internal radiation. With external radiation treatments, the radiation is delivered to the tumor from outside the body using a specialized radiation treatment machine which targets high-energy X-rays at the cancer cells from outside the body. This is the most common radiation therapy treatment for cancer. For skin cancers or lesions near the body surface, a low-energy X-ray radiation therapy machine is used to deliver the radiation. Superficial radiation treatment is a type of external radiation therapy treatment that doesn't go any deeper than the skin, limiting the side effects to other organs and body tissues. The other type of radiation treatment, called internal radiation therapy, is also called brachytherapy. With internal radiation therapy, the treatment is given using a device that places a radioactive source near or into a tumor inside the body. Our radiation oncology program has state-of-the-art technology and equipment. We actively pursue radiation treatment advancements while contributing to developments made in this field through clinical trials and research. If you are interested in participating in a clinical trial, please talk to a radiation oncologist to see if there's a clinical trial that is right for you. Most people do not feel any side effects at the beginning of their radiation therapy. However, the side effects of radiation treatments do develop over time, with the most common side effects being fatigue and some skin irritation within the treatment area. Generally, side effects are limited to the area being treated by radiation. For example, your hair will not fall out unless the hair is in the treatment area. In these cases, some hair loss can be expected, but most hair will regrow. Most patients do continue to work and maintain day-to-day activities while completing their treatments, but each patient and treatment is different. It is important to discuss with your radiation oncologist the side effects that may be experienced both during treatments and the long-term side effects after your treatments are complete. Manitoba has 2 radiation treatment centers, Winnipeg and Brandon. Your radiation oncologist considers where you live and what type of cancer you are being treated for when deciding at which location you will receive treatment. Radiation treatment plans may require one session or several treatment sessions, which need to be scheduled and completed over a period of weeks. Typically, radiation treatments are scheduled once per day, Monday to Friday. Most treatments are completed in 10 to 15 minutes. However, some complex treatment techniques can take longer. You will receive the date and time for your first treatment session on the day of your CT simulation. You will then be provided with your treatment appointment schedule on a weekly basis. If you have a need to change an appointment, please speak to one of the reception clerks. Thank you for watching this Introduction to Radiation Therapy video. For more information, check out our other videos in the Radiation Therapy Treatment
So
video.
we can end the video here, and we're going to move to the next one. So these videos will be available online later as well on our website. So we hope that these will be very helpful for you, and we'll get right into the second video, which is going to talk about who you'll meet in the radiation therapy cancer team.
Or in the correct treatment position. Once your positioning is confirmed, introduce you to your radiation therapy treatment team members and their roles. Your care team will include a radiation oncologist, nurses, radiation therapists, medical physicists, and clerical and healthcare aid support staff. We are proud to be an accredited training center for radiation therapy professionals, which means that the team is responsible for training radiation oncology residents, medical physics residents, and radiation therapy students. You may meet these professional trainees throughout your treatment. A radiation oncologist is a doctor that specializes in treating cancer with radiation, and a radiation oncology resident is a licensed doctor who's trained to be a specialist. Your attending radiation oncologist is responsible for all the decisions that affect your radiation therapy treatment care. Radiation therapists are medical radiation technologists responsible for accurately positioning the patient, taking CT scans for simulation, designing treatment plans, and delivering the treatment. In addition, they provide support and counseling to patients and their families, including making referrals to other members of the healthcare team. Student radiation therapists may also be part of the treatment team, and they will be under the supervision of a qualified radiation therapist. Radiation oncology medical physicists are physicists that specialize in radiation treatment and medical imaging. They are responsible for developing treatment techniques and quality assurance methods to ensure radiation is delivered safely and accurately. They may also be consulted by radiation oncologists and radiation therapists for their expertise when designing radiation treatment plans. Nurses work with the radiation therapy team both in the clinic areas and in the radiation treatment department. They assist with IV contrast procedures for CT simulations, help patients manage their treatment side effects, monitor and care for patients closely during medical procedures, and provide support to patients before and after radiation treatments. Support staff provide patients with their appointments and assist patients with basic care and mobility needs they may have. Along with these core radiation therapy healthcare team members, you may also meet pharmacists, physiotherapists, dietitians, speech-language pathologists, social workers, child life specialists, and other healthcare team members who may be involved in supporting you throughout your treatment. You, the patients, are a very important part of the team. We invite you as patients and family members to engage with your doctors and healthcare professionals and to participate in the decisions being made. Keeping records of your medical history and sharing up-to-date details with your healthcare team or through our interactive patient apps helps with these decisions. Since there will be a lot of information provided during this process, and it may be overwhelming at times, you may want to consider involving a trusted family member or friend in your care team. When possible, it may help to have a companion with you to hear the information being provided. If you don't understand something, please ask questions until you do. Thank you for watching this Introduction to Radiation Therapy video.
So for our last video, it's a little bit longer, it's 9 minutes, and we're going to show how the preparation and the treatment process, what that looks like. So we'll get right into it.
Hello, everyone. The time from diagnosis to treatment can be a time filled with a lot of questions and uncertainty. This video will show you what the typical consultation, preparation, and treatment process is like. But know that your experience may be slightly different, as each patient receives a custom and unique treatment plan. Your team will also explain each step as you go. Please let any of your radiation treatment team members know if you have any more questions. When you are first referred for radiation therapy consultation, you will meet with a radiation oncologist to review your diagnosis, your health, and your treatment goals, and then to determine together what the best treatment option is for you. At your consultation appointment, the radiation oncologist will discuss why radiation is being offered, the total number of treatment sessions required, and the possible short and long-term side effects. Once your treatment goal and plan have been identified, the first step in planning your custom radiation treatment is to have a CT simulation. When you arrive for your CT simulation and radiation treatments, you will be greeted by clerical staff who will confirm your name and date of birth with your Manitoba health card, and then check you into the department to notify the radiation therapist of your arrival. Depending on the area being treated, you may be asked to change into a hospital gown or hospital pants. You will be shown where to change and where to wait for your appointment. Additionally, on your first day in the department, the staff, with your permission, will take your photo and upload it to your radiation therapy treatment chart. This will allow for treatment staff to confirm your identity for each treatment. You will see a team of radiation therapists for CT simulation and each radiation treatment session. The therapists will guide you through your treatment and are available to answer any questions you may have throughout the process. Please note that companions are permitted during parts of the procedure, but will be asked to step out during the delivery of radiation. CT simulation uses a CT scanner to obtain images to be used for radiation treatment planning. The CT images allow the radiation oncologist to locate the tumor in surrounding areas that will require treatment. Radiation therapists will perform your CT simulation, and this process will take approximately 30 minutes. You may be asked to change into a hospital gown or pants and to remove metal objects such as a belt, jewelry, dentures, and eyeglasses, which may interfere with image results. You may also receive special instructions for your CT simulation, such as filling your bladder, holding your breath, drinking oral contrast, or receiving IV contrast. Your radiation therapy team will discuss these instructions with you. During the CT simulation, the position you will need to be in during radiation therapy treatments will be determined, and a CT scan of you in this position will be taken. This position will need to be comfortable while allowing for it to be reproduced for each treatment. Depending on the area being treated, an immobilization aid may be used to help you remain still in the required position for each of your treatment sessions. These immobilization aids can include a mask, the use of a beanbag-like cushion, or rigid boards to maintain the position. For example, if you need radiation therapy to the head or neck area, a special mesh mask may be made. This mask will help you stay still during treatment and will be worn for each treatment. Once the CT scan is taken, marks known as reference marks will be drawn on your skin or your mask and used to help the treatment radiation therapist position you for each of your treatments. These marks can be made with permanent markers or tattoo ink. The tattoo marks are the size of a freckle. Sometimes you'll need multiple marks or tattoos. The radiation therapy team uses a combination of laser lights and these marks on your body to ensure that your body is precisely aligned and positioned for each of the treatment sessions you will have. After your CT simulation, you are free to go home. The images and information are transferred to the treatment planning system so the radiation therapy team can complete the second step of the preparation process, which is to design your custom treatment plan. Designing your treatment plan requires detail and can take several days to complete. The plan design team includes radiation therapists, medical physicists, and your radiation oncologist. The plan design process includes many calculations to ensure your plan is appropriate and ready for treatment. Treatments usually start about 2 to 3 weeks after your planning session. For your first treatment appointment, the treatment radiation therapist will show you the console area, the treatment room, and the equipment and explain to you what will be happening. Depending on your treatment, your appointment may take between 10 to 15 minutes. There are some treatments that do take longer. During the treatment setup and treatment, you will be asked to lay still. The treatment machine will move and rotate around you. It may come close, but will not touch you. When the machine is on, you will hear a humming noise. You will not feel anything during the treatment. Most of the time in the treatment room is spent explaining the procedure, placing you in your treatment position, and taking X-ray images to ensure you are in the right treatment position. The time the machine is delivering treatment is the shortest part of your appointment. For each treatment session, you will be set up in the same position you were at the time of your CT simulation. Once you are lying on the treatment table, you will be able to feel the table move. It rises 3 to 4 feet off the ground as it goes closer to the machine. The markings on your body or on your immobilization device will be used to recreate your treatment position. This may require a treatment radiation therapist to move and adjust your position. We ask that you allow the radiation therapist to do the movement and to try and not to readjust yourself. Once your tattoos and/or markings are lined up to the lasers within the treatment room, you will feel the table move again. This is your starting position for treatment. The treatment radiation therapist will then leave the room to begin your treatment. Although you will be alone in the treatment room, the radiation therapist will be just outside the treatment room in the console area and will be watching you on a camera. There is also an intercom system that allows you to speak with the therapist while you are in the room. Additionally, if your treatment technique requires instructions, you will hear the radiation therapist speak to you over the intercom before the treatment begins. Prior to turning on the treatment beam, X-ray images will be taken. These images allow radiation therapists to match the position of your bones and other organs to the X-rays in the positions taken during your CT. Although the radiation therapists have positioned you based on your markings and the lasers, they will now further adjust your position based on the images. This is very important, as it is this position that your treatment plan was created for, and the goal of each treatment is to recreate the same position. Once the imaging positioning match is completed, you will likely feel the table move. Do not be alarmed by this movement, as this is the treatment therapist moving the table from outside the room based on how your positioning matches. These movements are millimeters and centimeters at most. If therapists need to change your position, they will come back into the room and readjust your position. The treatment therapist will not turn the treatment beam on unless they are confident you are in the correct treatment position. Once your positioning is confirmed, your treatment will begin. Your treatment may consist of the machine treating with the beam from a variety of angles to achieve the best distribution of the dose to the area. Some treatments may be done in an arc formation, where the treatment beam is delivered over 360 degrees as the machine rotates around you. Once your treatment has been successfully delivered, the radiation therapist will come back into the treatment room and begin lowering the table to move you away from the treatment machine. Please do not move until your team tells you that it is safe to do so. Thank you for watching this radiation therapy preparation and treatment video. At this point, you may feel overwhelmed. Please trust that your healthcare team will guide and support you throughout your treatment.
So that's it for the videos this morning. I hope that you'll find them on the website in the next week or so at CancerCare, along with 3 other videos. Actually 4 other videos talking about other aspects of radiation therapy. So I do see there's a couple of questions. Donna, do we have time?
Yes, I think we have certainly a little bit of time for these. Thank you very much. I wanted to acknowledge that Lorette, I think, commented that the videos are so helpful, and it's been upvoted several times. So I think she speaks on others about how helpful they are. Just wondering if we could, and I'm going to ask if we can sort of run a tiny bit into the break, because there's some really good questions here. And the first one is around the difference between proton and traditional radiation therapy. What's the difference there?
So I'm not an expert on proton therapy. We do not offer it in Manitoba at this time, but it is offered in Canada. And it is considered to be a very precise form, a little more precise, I'm not sure if that's quite the right word, than photon therapy. But here in Manitoba, we offer gamma. There's 4 different types of radiation therapy. There's gamma, there's electron, and photon, and proton. So we offer all of them, but not at this time proton. So yeah,
Okay.
you probably need to find an expert to find out a little bit more about it.
Well, it's really helpful. I think, it's really interesting to hear that radiation comes in so many different flavors. I think, for most of us, we don't really realize that. So thanks for that. There's another question here about, can you have radiation only once in your life, or can you have it many times?
You can have it more than once. What we do consider when offering radiation therapy is how much radiation dose you've had to certain organs in your bodies and certain tissues. So there is a limit where you can only receive so much before it is more harmful than good. And so your physician would always assess what you've had before for radiation and where, and then look at what could be done for a second time for radiation. So definitely we do have patients that come in for multiple sessions of radiation.
Okay. So it's kind of a balance between, the having enough radiation to treat the cancer that's needed, but not so much that it's actually going to expose somebody to excessive amounts of radiation over time.
That's correct. Yeah.
Okay, thanks very much, Cyndy. And so kind of a related question about why do some people receive 5 radiation treatments?
So this is where customized treatment plans will come in for each patient. So depending on what we're treating and the goals of your treatment, also depending on some of the science for different prescriptive amounts of radiation, we try to bring our patients in for as few visits as possible. So we're always looking for that because we know it's not easy to come in for multiple treatments. And so when possible, physicians will prescribe less fractions, but they're going to look at the outcome and the goals for your treatment, and they're going to offer you the best number for you, and they'll discuss it with you what that means.
Okay, thank you very much, Cyndy. So I think I just wanted to a shout out to everybody who is commenting about how helpful the videos are, including about how you figure out where to put the markers and the movement of the bed. All of those things are really helpful for people in terms of preparing them for what to expect. So thank you, Cyndy, and your team for putting together such an excellent series of videos. And for folks who are online, yes, these will be available online. You can watch them again and replay certain sections that you might find more helpful. Okay, and we're going to take
shout out to the foundation as well for supporting our project. That was very helpful.
All right, thank you very much.